Okay, everyone, we're going to get started. Welcome to Conversations with Dr. Fryson. I thank everyone for watching. For those of you who were unable to join me during the Zoom, this meeting was recorded, is recorded, will be recorded. So I appreciate everyone who takes the time to watch. If you are watching and you are unable to send me a question during the actual time that this is being recorded, please feel free to place your question in the comments. If you don't place them in the comments, you can always visit my websites and actually leave me a message. I look forward to your messages, and your comments and questions are the reason that I create these. When you have a question about a product or a thing that's happening in society, my goal is to educate you regarding it within the realm of natural health, right? So that's what I'm here for. That's what I'm going to do. Okay, so that being said, let's get started. Okay, hopefully everyone can see my screen, the presentation here, and just a moment. Okay, so hopefully everyone can see my screen. So let's get into it. Okay, today's topic is chamomile versus melatonin, presented by yours truly, Dr. Fryson. I am the CEO of FIG LLC and several other businesses. So we're going to have a discussion of regarding the chamomile versus melatonin because of my niece. My niece mentioned this as being an issue in the crunchy mom industry. So I wanted to go over some things and hopefully help you guys understand it better. Okay, topics we're going to cover: an overview of chamomile, an overview of melatonin, and a brief overview of the controversy regarding the two. Today's topic is brought to you by my Calm Your Ass Down Herbal Lemonade, which is a chamomile blend of lemonade concentrated and designed to help you get some relief and some sleep. So let's start with chamomile. First thing we want to know about chamomile is that it's a daisy-like plant. It's from the Astraceae family. There are two forms of chamomile that are commonly used. The first one is Matricaria chamomile, And the second one is Chamomile noble. Those are the ones that are used normally in the United States to make herbal infusions. Chamomile is currently being studied for its anti-anxiety properties. So, although the FDA does not allow anyone to say that chamomile is able to help reduce anxiety, there are some hints at it being able to do so. And therefore, they are currently studying it to see just how effective it is with the anti-anxiety. This is why there's people taking it for anti-anxiety off label. It's important to note that there are other plants that contain the word chamomile. The use of those other plants is not necessarily the same use as the commonly used species mentioned above. Also worth noting is that Marticaria chamomile is also called German chamomile or water of youth. So if you see those two names, you will understand that it is chamomile associated with the herbal infusions. And that's for all of you herbalists out there if you're trying to purchase chamomile in bulk form and make some herbal tea. So let's discuss chamomile uses. One, historically in the United States, it is used as a flavoring agent in foods, beverages, even mouthwash, soaps, and cosmetics to make them taste better because chamomile in general has a nice flowery type flavor, right? It is from the daisy flower. And I want you to understand also that the chamomile that is used in the tea is just from the flowering parts, not the whole plant. The whole plant is used in making beer and ale. Imagine that. So, I don't know if any of you drink beer out there, but I wonder if you get really sleepy afterwards. I have heard some people say that beer kind of depresses their system, means calms them down, which chamomile has that kind of effect on the body. It calms the body in a lot of ways. The flowers, of course, makes tea. So, what are the benefits of chamomile? What's the hype? One, it contains antioxidants. Two, it promotes sleepiness. Three, it improves sleep quality. Four, it has antibacterial properties. Five, anti-inflammatory properties. Six, it protects against diarrhea, helps with stomach ulcers, helps to reduce nausea and gas, and it helps promote a healthy digestive system. Now, these benefits come from claims made by medical and nutrition professionals. I have references at the end of the PowerPoint. So this is not what the shamanic native person is telling you. This is what the FDA says. And holistic, herbalistic cultures, these things are considered facts, not considered unknowns. I am speaking on these as an unknown from the FDA standpoint of view. In my natural health practice, chamomile is something that I recommend to my clients who have some of the issues listed on this slide. The part about antioxidants we're going to get into in greater detail in a moment. Additional benefits of chamomile: it manages diabetes, manages menstrual pain, helps with osteoporosis. Now, osteoporosis, of course, is a bone disorder. It can target cancer cells or prevent the growth of them in cases of liver cancer, cervical cancer, and leukemia. Of course, preventing the growth of cancer cells means that it may have those antioxidant type of properties, and this is currently being studied. In 2019, there was a study that showed that people suffering from generalized anxiety disorder, which is a medical condition, saw an improvement in their symptoms after using chamomile for 2 to 3 weeks. It supports the immune system and it treats acne and skin dehydration. So, those who know me know I do drink the chamomile tea. I drink my other teas, and people are always talking about how good my skin looks. And guess what? Might be due to some of these natural herbs that I'm taking. Chamomile compounds, the things that are within chamomile that help it to be so beneficial are many, but there are a couple that seem to be the ones out there being studied. One is coumarins. Coumarins are anticoagulant, they're anti-inflammatory, anti-tumor, antibacterial, antifungal. That means anti, for those who don't know, means against. That means they are against coagulation, against inflammation, against tumors, against bacteria, against fungi. That means that it fights those things. So for people who have clotting disorders, such as myself, this helps fight the clots. People who have inflammation from lupus, such as myself, this helps fight lupus. Now, this information is coming from a medical website, so these things are actually being studied. These things are known about chamomile, and they're being studied to be put into an actual pharmaceutical. So if you can get it in the chamomile today, why wait for the pharmaceutical tomorrow? Another component of chamomile is flavonoids. So there are studies about flavonoids that show that they may reduce blood pressure, which let's just think about this from a holistic standpoint. One of the reasons that blood pressure is elevated in the United States is due to stress. Another reason it is elevated is due to lack of sleep, because the sleep itself regulates a lot of different cycles, right? It's really when your body does its best form of healing. If you can get your sleep corrected, it is only natural to believe that you can also regulate your blood pressure and regulate other hormones just by balancing your sleep. So the flavonoids within the chamomile help in that sense to reduce the blood pressure. And some studies show that they have an impact on cancer, inflammation, and heart disease. Now, again, the FDA has not signed off on these statements, but these studies have been conducted, and this is what they're showing. Another ingredient within it's a compound because it's a part of it within the chamomile is polyphenols. There's actually evidence showing that polyphenols can help reduce breast cancer in postmenopausal women and prostate cancer in men. That alone is enough for you to just want to add chamomile tea to your diet. Polyphenols are being studied for possible cognitive effects in healthy adults, meaning they are being studied to see if they have an effect on the brain, enhance memory, maybe prevent memory loss, things of that nature. But it's in healthy adults. So that study is ongoing right now. That's kind of should let you know that chamomile itself may be helpful with the brain. Now, the reason I do these presentations is so that you can see the warnings, because when I work with my clients, I do a holistic approach to what they are taking, not just the pharmaceuticals, but the herbs. I always tell people that everything has some type of effect, and not every effect is good for every person. Depending on what you have going on in your life as to whether or not you should take something. Okay? So just because everybody else is taking it doesn't mean that it's going to be good for you. So let's talk about a few of the warnings regarding chamomile. One, it can interact with prescription drugs. Because there is not enough evidence out there to say that chamomile actually helps with heart failure or coagulation or things of that nature, it could be having an effect in those areas. And then you could be on a medication that is trying to prevent coagulation, and you can get yourself in a situation where you now have excessive bleeding, right? Because then you're not able to form clots. So it's very important to note that it can interact with prescription drugs. It could worsen your pollen allergies. It is a flower. It's from a flowering plant. If you are allergic to ragweed, they tell you don't take it. Take chamomile because you may be allergic to chamomile. Now, if you have done allergy tests, the RAS test, and you know that you're not allergic to ragweed, then certainly chamomile may not have an effect on you. If your allergy to ragweed, is minor, then you might not have an issue with the chamomile. Okay, but just know that if you have a ragweed allergy, this chamomile might aggravate it. It cannot be taken with aspirin or NSAIDs, and NSAIDs are non-steroidal anti-inflammatory drugs. Now, I know as a person with lupus, I was told not to ever take NSAIDs. And I know other people, if you have stomach ulcers and different things, you've been told not to take NSAIDs. One of the reasons why it is said not to take chamomile with the NSAID is because chamomile is also an anti-inflammatory agent, and it could have an impact combined with the NSAIDs and kind of almost turn off your immune response, because inflammation is a part of the immune response. The problem becomes when inflammation is out of control. People with a history of breast, ovary, or uterine cancer, endometriosis, uterine fibroids are recommended not to consume chamomile. And I'm not exactly sure why this is the case because I could not find anything out there that says don't take it because of this reason. I believe it is because of the antioxidant properties that are associated with chamomile, and this could be a problem for people with certain medications, but there's not any documentation that I was able to find to support my belief. And chamomile can cause uterine contractions, meaning it can lead to a miscarriage. So a person who is pregnant are advised not to consume it. Now, when you go to the store and you see chamomile tea in the store, it doesn't really come with warnings like this because, in general, chamomile is considered to be safe. It is considered to be safe in the dosages that are available within the United States, within a cup of tea. It's considered not to really cause too much of issues, but you have to be aware that there's a possibility of issues being caused. So, to the point of what my niece was talking about, there's an issue with children not being able to sleep. And the Crunchy Moms is a group of people, women, moms, who actually have children who have problems with sleep. And so they are saying they should use chamomile instead of melatonin. Thus, this presentation. Let's discuss the warnings with children in chamomile. Doctors recommend young children and infants avoid it in honey because of the possibility of botulism spores being present. Now, why are botulism spores present in anything in the United States? That's another story. That's something that should be evaluated in general. But because the United States does not regulate some things as much as other things are regulated, you don't know what people are doing when they are processing and making things like honey and chamomile tea. Understand that in Europe and other countries, there are very strict requirements on the processing of chamomile, honey, and other things. As a matter of fact, there are a lot of things utilized within the United States that are not utilized in other countries because they are deadly. So if you have a child, I would definitely watch them. If I'm just getting something randomly from some place, I would definitely want to be careful with them and not necessarily give them things that I don't trust. This does not say that every child who takes chamomile or drink or honey is going to have botulism. It's just the fact that there's a possibility, and therefore the warning is out there. So that's enough about chamomile. Let's look at melatonin. First thing I want to say is that melatonin is a hormone. It is naturally secreted by the pineal gland, and it is secreted normally in darkness. So that's the time, we get ready to go to sleep, nighttime. Melatonin in the normal person, like the child, is secreted and helps them feel sleepy. It is a hormone, right? That is important because that's part of the controversy. It controls the sleep wake cycle in humans and all vertebrates. It synchronizes the circadian rhythms, and these circadian rhythms include sleep wake timing, blood pressure regulation, and control of seasonal rhythmicity, which includes reproduction, fattening, molting, and hibernation. Because the vertebrates go through that process: reproduction, fattening, molting, and hibernation. The humans go through those processes of reproduction. We do go through a fattening, we do go through a shedding in sense, and we do go through a type of hibernation. It is not exactly the same as a bear where he just goes in and completely sleeps, but we go into a winter mode where we don't necessarily want to go out and do things, and normally we get fat. We are controlling our energy reserves, right? Here is the chemical structure of melatonin with all the carbon and hydrogens, nitrogen and oxygen compounds there. So that's the makeup of melatonin. Again, it is a hormone. So how does melatonin actually work? It works in several ways. One, it acts on two different melatonin receptors, thus controlling sleep. There's a melatonin receptor 1 and a melatonin receptor 2, and melatonin, the hormone, acts on those receptors, and depending on which receptor it acts upon, sleep is controlled. It also acts as a free radical scavenger within the mitochondria, which is in the DNA, and promotes the expression of antioxidant enzymes. Now, if you've been with me for a while, you know that enzymes cause reactions to take place. They break things down. In the essence, that lipase is an enzyme that breaks down fat, right? Antioxidant enzymes. So antioxidants are things that work against the oxidation. So antioxidants prevent oxidation. Oxidation can lead to the production of free radicals, which can produce and increase cancer. Okay, that's important. In obese people, there's a decreased sensitivity to leptin. It's similar to insulin resistance. Melatonin works on that. What are the benefits of melatonin? One, it's anti-inflammatory. That means it may have the potential to fight acquired immunodeficiencies because it stimulates T cell expansion. Immunodeficiencies are like in HIV, AIDS actually is acquired immunodeficiency syndrome. So T cells are the cells in as part of the white blood cell system that help fight off viruses. And there's different T cells. There's a T helper cell, there's a T suppressor cell, there's different T cells. When you have the stimulation of them, they can fight off viruses better. In certain acquired immunodeficiencies, there is a suppression of T cells, and therefore the body is not able to fight off the actual immunodeficiency. Because of melatonin's anti inflammatory benefits, and its ability possibly to cause the stimulation of T cells, it can actually be useful in fighting some acquired immunodeficiencies. Again, the studies are not exactly there to say yay or nay, but it is definitely a possibility. Weight management. Melatonin inhibits leptin. So, leptin is a protein hormone that regulates energy levels and contributes to one's desire to eat. It's thought that melatonin suppresses leptin's actions outside of waking hours. So that means when you are asleep, and allows the body to not become resistant to leptin. High leptin levels tells the brain that one has good energy levels, which means you do not need to eat. Low leptin levels does the reverse, tells the brain, hey, your energy is low, I need more food, because food is energy. So the low leptin levels is telling the brain, feed me, right? And this may occur even if the leptin levels are actually high. And that could be because a person has a resistance to leptin. And this is similar to a person having a resistance to insulin when they see that in diabetes. And of course, eventually we're going to have a conversation about the pancreas and insulin resistance. So, in theory, if you can reverse or remove that resistance to leptin, a person would naturally know that they are full, they do not need any more energy, and they do not need to eat, which helps with weight management. Now, one day I'm going to have a conversation about weight management, because weight management is not just about what you consume. As we see here, it is also about what you don't get, like sleep. Sleep is truly one of the best things that you could do for your body. Melatonin is also used for people who have jet lag, people who have a disorder which is called delayed sleep wake phase disorder. So that means a person cannot fall asleep at regular times. It can be seen in autoimmune disorders such as lupus. It is very common in lupus. I'm in the lupus community and people complain about this all the time. I have experienced this myself where I'm up until 7, 8 in the morning and then I can't sleep. What do? I drink the chamomile tea. And I had some last night or this morning at 3 o'clock this morning and had a great sleep. That's what I do. Okay. It can be used to treat some sleep disorders in children. And interesting enough, it is used to treat anxiety before surgery. It is also used to treat anxiety after surgery, but there aren't enough studies about the after surgery effects. However, there are definitely studies showing it to be beneficial prior to surgery, right? So it is helpful for anxiety. So, what are the concerns over melatonin, right? In direct relation to melatonin use for children, because that's what my niece brought up. There are uncertainties about what dosage to use, right? People don't know how much melatonin to give. The biggest thing is, as a hormone, it is possible that melatonin can affect hormonal production and development in the child. including puberty, including menstrual cycles, including overproduction of prolactin. So that can be very dangerous for a growing child. The other thing that I found interesting is that there has been an increase in melatonin overdose in individuals under 19. So it is really, really dangerous if it's not washed. What are the warnings about melatonin? They say pregnant women should not take it because of the impact it could have on the fetus. Dementia patients should not use it. Of course, it is a product that impacts hormones. Hormones are definitely related to different functions within the brain. Information on the product label may not be what is in the products, meaning some products contain serotonin. Serotonin is a neurotransmitter which impacts the brain, okay, and is supposed to be taken in controlled doses. Now, why are these warnings out there if this is a regulated product? The problem with melatonin is that the FDA does regulate it, they regulate it as a dietary supplement. That means it doesn't have the same strict requirements of manufacturing as some other things, and therefore you don't know what the producer, the manufacturer actually puts in it. So the label just lists the dietary requirements, but doesn't necessarily list anything else like serotonin, right? So that could be deadly. What are the melatonin side effects in children? Because that was the biggest issue. That's why we're having this conversation. One, drowsiness. Two, increased bedwetting or urination in the evening because the child cannot get out of the sleep. Child can complain of having headaches. It is a hormone, and hormones, if as any woman knows, you go through hormonal changes, right? You have the menstrual cycle, you have hormonal changes. Sometimes you have a headache. So some children can complain of headache, dizziness, very, very dangerous, and general agitation. Your child can be more agitated when they actually wake up. And that's kind of due to the quality of sleep and also the hormones being impacted. What are the side effects of melatonin taken or uses in adults? Headaches, dizziness, nausea, sleepiness. Sleepiness is why people are taking it, right? They want to go to sleep. Now, not every person experiences these side effects, and the children nor the adults, but this is the information that's out there. Now, if you don't want to take the hormone melatonin that is over the counter, there are a few natural sources that you can take. Tart cherries, bananas, plums, grapes, rice, cereals, many herbs, olive oil, wine, and beer. So these sources contain melatonin, and that's another thing to note is that milk in combination with like bananas and cherries and stuff is a old wise tale where people would put those together to promote sleep. Okay. So that, my friends, is the information I have for you regarding chamomile and melatonin. Because of the hormonal impact, that's why the crunchy moms and many people in that community do not want to give melatonin to their children. They would rather give the chamomile. Again, this is an individual choice. If you prefer chamomile products, I have chamomile. I have chamomile to where you can make a gallon of it. I have chamomile in the bottles. I have chamomile in individual tea bags. You can get all of that from my websites. You can go to drfryson.com or you could go to tsfcenter.com It's been on the bottom of most of these slides. You can email me at drfryson@tsfcenter.com. Visit me on Facebook, Instagram, or YouTube. Send me a comment, send me a message. I would love to hear from you. Contact me. Here are my references, including the references for the pictures that I actually utilize in the program. That's it for today. Thank you guys so much for being here. I hope you enjoyed this presentation, and I look forward to seeing you on the next one. Bye.